oral medications. But before that, before administering oral medications, the nurse must know the 10 rights of administering medications. First is the right medication, the right dose, the right time, the right route, the right client, the right client education, the right documentation, the right to refuse, the right assessment, and the right evaluation. The purpose of administering oral medication is to provide a medication that has systemic or local effect for the GI tract or both. First is we need to assess the client for allergies, the client's ability to swallow, the presence of vomiting or diarrhea, which may interfere the absorption of medication, the client's knowledge or learning needs about the medication, and the drug action such as the side effects, the interactions, and adverse effects. Next is we're going to prepare the equipment. So these are the equipment: the client's MAR, disposable cups or glass cups, some medication. This is an improvised liquid medication, drinking glass, some cotton swabs, wet, dry, and for waste, and then some alcohol, sphygmomanometer and thermometer for checking of vital signs later. Next, we will now proceed to the preparation. First is we must know the reason why the client is taking or receiving the medication, and then check the MAR or the medication administration report for the drug name, the dosage, the frequency, the route, and the expiration date. And if the MAR is unclear, compare the MAR with the prescriber's recent written report and report for any discrepancies. Next is verify the client's ability to take the oral medications, and then organize the supplies. This will ensure that through organizing the supplies, it will save time and reduce the risk of errors. So to perform, must first apply or perform hand hygiene. So usually the soap and water is prescribed, but applying of alcohol is also considered as hand hygiene. So I'm going to apply alcohol. And obtain the appropriate medications. So this is my liquid medication. Since I don't have a liquid medication at home, I improvised this and poured some water inside. So usually medications are obtained at the shelves, at the drawers, or inside the refrigerator. Next is compare the MAR and the medication container. Check the drug name. This will ensure that the right medication is administered, and check for the expiration date. Since expired medication is not safe to be administered, so we must check the expiration date of the medications. Next is prepare the medications. then return this to the appropriate place. Next is prepare the liquid medication. So this is my liquid medication, an improvised liquid medication. And this is an improvised measuring cup. Then open the cap upside down so that it will not contaminate the inside of the cap. Then the label should be at the side of your palms so that the label will not be soiled or stained with the medication. And then pour the liquid medication to the medication cup at eye level. It should be at lower meniscus. And then clean the lid of the medication before capping it back. This will prevent sticking of the medication. So before returning the medications to the shelves, recheck again. This will serve as a second check if the medications were administered correctly or if it is the right medication that was administered. Also, before preparing the medication, must first check again. That will serve as the second time checking the medications to ensure that it is the right medication and to reduce the number of errors upon administering oral medications to the patient. Then, place the prepared medication and the MAR to the cart. This will be used to enter to the client's room. So I'm going to place this and the MAR to the cart now. Next is compare the room number and the MAR to ensure that the right client will be administered with the right medication. And then provide client privacy. Next is prepare the client. So, hi sir, ako si Elaiza Parone, imong student nurse karon. So sa karon mag-tumarta og tambal para sa imong samad-samad. So ang sa ka sir agakon sa sakto nga posisyon. Karon sir. Komportable ba ka sir? Okay, so gikuhaan na ba ka og vital signs sir? Katong blood pressure, BP, pulse rate, imong temperature, imong timbang. Kuma na? So, if the vital signs were already obtained by the patient, proceed to the explanation of the medication, the purpose of the medication, and how it will help the client. So, sir, moni imo tambal nga imong tumaron karon, moni siya ang ascorbic acid, moni generic name. Ang iyang brand name kay Ascorgen. O moni siya 500 mg nga tablet. Mo ba ni siya sir mo itumar hapon? Okay. So mo ni siya sir ang makatabang og tambal para mo siya tambal sir para maadyo imong sakit-sakit. Nani siya an kanang vitamin C para dali ra maadyo imong mga samad-samad sa piit. So mag-administer na ko sir. Next is administer the medication at the right time.
Prepare the medication at bedside.
Open your mouth, sir. Okay, good. After administering the medication, return to the patient at a desired time, or for example, after 30 minutes, return back to the patient's room and observe for any drug actions such as side effects, desired effects, interaction of the medication, adverse effects, or any deviations from the normal finding. So, sir, are you okay? After administering the medications to the patient, document all medications that was given. Document the drug medication, the dosage, the time it was taken, the assessments of the client or any complaints of the client, and then affix your signature. So if the medication was refused or omitted by the patient, record this fact as well as the reason for the appropriate record. So if the medication was refused or omitted by the patient, record this fact on the appropriate record, and then note the reason if possible, and then record the nurse's action according to the agency policy. After documentation, dispose all of the equipments appropriately to the appropriate container.